Welcome back to Breakfast Central on a Friday morning. We begin our conversations this morning in Kenya, where its President William Ruto yesterday signed 4 universal health coverage bills into law. The 4 bills include the Primary Healthcare Bill, Facility Improvement Financing Bill, Digital Health Bill, and the Social Health Insurance Bill. The Primary Healthcare Bill will help provide a framework for the effective delivery and management of health services using primary healthcare networks, PCNs, and community health units. Now, this means that Kenyans employed in the formal sector will make a monthly contribution of 2.75% of their salary, capped at a minimum of 300 Kenyan shillings and a maximum of 5,000 shillings.
Now, joining us this morning is Dr. Davji Bhimji Atellah. He's the Secretary General, Kenya Medical Practitioners, Pharmacists, and Dentists Union. Good morning, and thank you very much for joining us, Doctor.
Good morning to you.
This bill seems very unpopular amongst many Kenyans, as they see it as another form of being taxed. How is the medical profession receiving this bill, and do you see this flying?
To Kenya today, the issue of universal health care launch is not new. I think we say the government has specialized in launching universal health care because this is the 4th time that they are launching it, because the first was in 2017, the next was in 2020, then in 2022, and now it's in 2023. And in each of them, there were budget implications of over 60 billion Kenya shillings in each launch. The difference now in this new launch, we are asking that what makes it quite unique, because all the launch that have been done, there's always no clear follow-up and implementation to make Kenyans actually access care. But then with that period that we have seen different launches, the public health care in itself has been dysfunctional, and even the employment of health workforce has actually reduced over that time. But the reason why this has been received a lot of, being considered controversial, is that there's now a contribution, or rather change in the contribution brackets of the Social Health Insurance Fund. For a long time, the contribution has been at around 1.7%, with a capping at 1,700 Kenya shillings for the highest contributors. But with now this Social Health Insurance Fund bill, it means that at 2.75%, the person who was contributing 1,700 will now be able to contribute 3 times. But there's no assurance that the public hospitals or the hospitals in the country will be able to cover the Kenyans with the equivalent amount of contribution that they're doing. And that's why many workers are seeing this as increased taxation. But this is also happening at a time when we have seen in the last 1 year a lot of deductions in the workers' pay slips. It is indeed this year that we have seen housing levy, which is deducting 1.5% from workers' gross salaries. This now is going to deduct 2.75% from the workers' gross salary. We have also seen an increase in tax brackets in the country. We have seen double increase in the fuel tax. So essentially, the workers of the working class are seeing that with this new social health insurance fund, or rather the social health insurance bill, there's going to be an increased taxation of the workers. I mean, those who have already been contributing about 52% will be going to contribute over 54% of their gross salaries. That's why there's a lot of concern from workers. On the medical perspective, I would say 2 things. The one thing is that as of now, many Kenyans are spending out of pocket over 150 billion Kenya shillings to seek care, because the public hospitals are strongly dysfunctional. So if we have the Social Health Insurance Fund again introduced without commensurate employment of health workforce, then it's just been a normal tax. When we have this issue of the second bill of the primary healthcare bill, which has resulted into engagement over 100,000 community health promoters, which in essence are not healthcare workers. These are people within the community that are popular and then appointed to be the promoters. In essence, they cannot replace the work of the skilled health workforce. We have, as I said, a big shortage of health workers within the public facilities, and we have unemployed doctors, we have unemployed nurses within the country. So it is like a tax shifting mechanism within the government, because most of the population would wink that the community health promoters who are not skilled in any health services will be taking over to manage the healthcare. That is the narrative that we find that it will be possible to achieve that if the hospitals are not employing the health workforce that is needed to them.
All right. I want to also talk about funding, the health funding, because some of the excuses behind these deductions from worker salaries for health and the likes is because maybe the Kenya healthcare requires more funding or requires better funding. So do you think that this might be a reason that would fly if you tell Kenyans that if we take out this amount of money from your salary, would have more money to create a better healthcare industry for you? Will this make any sense to Kenyans?
That is the narrative that has been used because there is data indicating that the out-of-pocket expenditure for the country is at 150 billion. And with this introduction of 2.75%, therefore the Social Health Insurance Fund is expected to collect 150 billion then to cover all Kenyans. But then there has been a consistent history in National Hospital Insurance Fund where there has been lack of accountability in these particular funds, and that's why the majority of Kenyans have all been spending out of pocket to get the care. So if that accountability or corruptions or pilferage of funds from these National Hospital Insurance Fund has not been managed, then it means that there'll be just more money or more pool of money for corruption in this social health insurance fund. The other thing is that a lot of money, a big percentage, over 80% of the current collections in the National Hospital Insurance Fund has been going to private facilities, which covers or serves almost mostly middle class or about 20% of the population. Majority of Kenyans would go to the public facilities who will not get care because they are dysfunctional. They do not have drugs, they do not have personnel, and they do not have reagents. And therefore the concern is whether with these huge collections, with this increase in collections, is it going to have a functional healthcare? We are seeing another time that we are having a launch of universal healthcare in the country. The previous three launches failed, and they failed because there was no implementation of those policies that had been planned. So what is it that is different with this fourth launch, which now again is increasing deductions on workers without having to ensure that hospitals now are functional before it is launched? That is the concern and the fear that many people are having.
All right, let's talk about how exactly this impacts people. You've given us a picture of how Kenyans and how the medical society is reacting, how there have been some failed health insurance schemes in the time past. Earlier this year, sometime in June, President William Ruto signed the Finance Act. There was a lot of uproar against that as well. Now, some of the conversations that we're seeing are that people are saying that the economy needs to have been fixed first before this new implementation in the healthcare space would have been carried out, because the people who are bearing the brunt of this are those who are at the lower end of the ladder. So how exactly, I know that the government is also making some concessions for those who may not be able to pay up the 2.75%. But how exactly, first of all, is the economy? Give us a picture of what the economy currently is in Kenya, and how exactly people are going to be able to feed, because they need to be able to feed and survive and have a decent life before they're able to pay the tax on healthcare.
Healthcare also has to consider the social modalities of the people and how they live. And most of the times, people will tend to seek healthcare also if they can be able to buy food and survive. The reality is that the economy is on a downward trend for the last 1 year, and sometimes there may be a lot of rhetoric from government or from political leaders to indicate that the economy is doing well, but the reality is seen. For example, at the moment, the exchange rate for $1 to Kenya shillings is at 158, which is the record highest that have ever been seen. And at the time of this government coming into office, it was at $1 to around 130 Kenya shillings. If you look at the cost of fuel, at the same time last year, a liter of petrol was going for around 150 shillings, but now it's going at 210. With this finance bill, it's doubled the tax, the VAT tax, the value-added tax on the fuel. So, in essence, the income of workers or the country has reduced. Why am I saying this? This is because of the inflation. There's the highest level of inflation that has been experienced, while the income has remained constant. So those commodities, fuel, the household that people were able to afford earlier, they're not able to afford today in the same manner. We have also in the medical fraternity now, the drugs. The hypertensive generic drugs were going at about 3,000 Kenya shillings for somebody who was taking the drug for a whole month. Now the same person has to spend 6,000 and some have to spend 9,000 to get the same drugs. So it is real, in real essence, at the moment the economy is on downtrend, and most of the population, the purchasing power has gone lower. We have had an outcry from the Employers Federation indicating that majority of the Kenyans have contravened the 1/3 rule in payrolls, which indicates that if you have loans or if you're having any loans, your deduction should not go beyond 1/3 of your salary. But now with the introductions of different levies, the housing levy, the taxes, and even now these National Hospital Insurance Fund, it means many Kenyans will actually be deducted below 1/3 of their take-home in their salaries, which then will make them have a lot of difficulties even to purchase the normal living expenses. So the reality is that the economy is actually doing badly, and I think we say a lot of times that the government will be showing that they have interest to construct houses, they have an interest to construct, to have healthcare, they have an interest to have pension, because the pension was increased. But in reality, I think I want a pool of funds to show to the IMF and the World Bank that they can access more loans. I think that's essentially what the government is doing, while it's trying to really show that they want to help the Kenyans to access all these services.
All right. Now, on a final note, you are, of course, the Secretary General of the Kenyan Medical Practitioners. If the medical practitioners could have a one-on-one with President William Ruto, what are some of the suggestions that they would bring up in response to him working on the medical space, working on healthcare? What are some of the suggestions or better alternatives that they would have preferred?
We have had one-on-one. In fact, yesterday we were in the State House during the signing of these bills. But the reality is that what we say every day is that if you look at these 4 bills, there is the Facility Improvement Fund or bill, which we believe that will concentrate funds to the facilities. We have the digital bill that will make it easier to have digital records of all the things that are needed, all the medical records. We also have, if you look at all those bills, the reality is that they remain just documents if we do not have health workforce. The country has a bigger shortage of health workforce in the hospitals. And there's a big number of health workers who have graduated and who are not employed. So the first step is that as per the manifesto of this government, they promised to employ 20,000 health workers to make it possible for Kenyans to access care. And therefore, universal health care may be a good thing, and it's a good thing for everyone, but it remains a pipe dream if there are no health workforce that are engaged to work in those facilities and to ensure that these bills that are implemented for the benefit of the Kenyans. That's the reality. That's what we had discussed with the President in February this year. We have talked about it in Labor Day this year. Yesterday, we regretted the same when these bills were being signed. And therefore, we believe that that's the only way. It is the only way that people can access care, the Kenyans can access care, is to actually employ and invest more into the health care than just saying that we have the bills.
Well, President William Ruto did make promises of reducing the cost of living when he was campaigning and when he was getting into office. Yes, doesn't seem like a lot of that has been achieved, but we, of course, will follow up with this conversation, and if there's any developments, would like to have you again join us, Dr. Davji, Bhimji, Atellah. Thank you very much for your time this morning. Speak with you again pretty soon.
Thank you so much.